beginning our BFR, or blood flow restriction parameter review, I want to just give kind of the disclaimer that the length of BFR should be no more and should not exceed 25 minutes. And there's not really any necessary detriment to exceeding 25 minutes, though the research that we have currently says 25 minutes is about the maximum time we want with those cuffs occluded, meaning when that tab is pushed and the clock is turned. It likely is your first time using blood flow restriction training. If that's the case, or you haven't worked out in a while, or you haven't even been active in a while, what I'd recommend is starting with about 10 to 15 minutes with a cuff occluded rather than jumping to the 25-minute mark. So to review the workout parameters, which essentially is how many sets, how many reps you'll be doing, there are three options that we recommend that is backed by research. The three that we have here, it's a 30-30-30, and each respective 30 is a set, set 1, set 2, set 3. Between each set of 30, you would take a 45-second rest. You have the second option, which is 30-15-15-15. Instead of a 45-second rest, you're taking a 30-second rest between sets. And our third option is go into muscle fatigue, which is essentially you're going, and you can't go anymore because that muscle is burning and you need to take a break. Regardless, whatever one you decide to do, after you've performed the entirety of it, 30-30-30, 30-15-15-15, you're going to take a 2-minute rest. What you can do after that is either perform the same set program or a varied or mixed bag of them. What's important is that you do not necessarily need to do the same exact exercise every time. You can, if it's recommended by your rehab specialist, squat, 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 curl, 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 but you can also perform varied exercises to target different muscle groups. Squat, deadlift, leg press, curl, overhead press, tricep extension, side raise. Various different exercise opportunities within the 25-minute range that we're allowing for our workout parameters. With any exercise, whether it's with or without blood flow restriction training, there are expected and unexpected or abnormal side effects. I want to review those with you now. So the expected side effects, of course, you're doing workouts with blood flow restriction on, you're going to have muscle soreness. Expect that, especially the day after, and that's what DOMS is, delayed onset muscle soreness. You might have muscle soreness for 24 to 48 hours after. Anything exceeding 48 hours is usually a little too much, meaning talk to your rehab specialist to address your workout plan. You may have local bruising. You're using a blood flow restriction cuff around a small area. That's going to cause pressure locally. That can cause some bruising. If there's excessive bruising, you'll talk to your rehab specialist to make a plan on how to ensure that the bruising doesn't exceed what we would anticipate as normal. You may have a limb color change. So you look down at your leg or your arm and it's a little red, a little darker tone, a little purple. That's okay. As long as it's not pale white or blue, you're good to go. Now, abnormal side effects. This is what we don't want. This is what I want you to be wary of. Numbness or tingling. Say you put the cuff on and you immediately feel numbness or tingling. It's too tight. You got to loosen it. Less occlusion. Say you put the cuff on, you feel fine, you do your workout, and then you're feeling it during the workout, the numbness and tingling. You need to reduce the weight first before reducing the occlusion. Remember, blood flow restriction is to occlude it. Otherwise, why use it? So we want max occlusion without abnormal side effects. So if you are doing the workout, numbness or tingling, reduce the weight first. And then of course severe pain. If you're doing any workout of any sort, blood flow restriction or not, and you're feeling severe pain, stop, let your rehab specialist know so we can address the reasons for that. With any exercise, whether it is with or without blood flow restriction training, you need to stay hydrated. Now, because we are talking about BFR, it's extraordinarily important to stay hydrated because of the metabolic demand of what these cuffs are trying to do. So, our recommendation, is 30 to 60 minutes before planning on using those cuffs, I need you to try to drink 16 to 32 ounces of water. That's about a bottle or two of water. Throughout that workout, that 25-minute workout, I would like you to be drinking some sort of fluid. It can be something with electrolytes, that's fine, but you need to be drinking fluids throughout the workout. You'll notice that probably that same day and the day after, you're going to be a little bit more dehydrated. I want you to continue to drink water, a Gatorade, a Powerade, something with electrolytes throughout the day, and especially the day after. If you're fatigued or you're feeling a little funky or off the day after, it is likely that you are dehydrated from the use of the blood flow restriction training cuffs.